Black. Today I've got the wonderful Carleen Miller coming in to join us. Hi, Carleen.
Hi everyone.
Hi. Now, before we do start, I would just like to acknowledge the traditional custodians of the land that I'm currently on. I'm here in Bowen Q on the land of the Wurundjeri people, and I pay respect to their elders past, present and emerging. Carleen, before we do start, tell us who you are, where you're from.
So I'm a Taungurung woman, First Peoples of the Rivers and Mountains from Central Victoria, from the Warring-illum Balug clan, river-dwelling people. And I'm coming to you from Templestowe Lower, from my home, which is also on Wurundjeri country, and I too pay my respects to elders past, present and emerging. And happy NAIDOC to everybody.
Yeah, happy NAIDOC. But by the time this one goes live, it will be after NAIDOC. But at least you know we're recording it in NAIDOC week.
That's it.
Cool. Have you always lived in Melbourne?
Yes, I've born and bred and grown up in beautiful Wurundjeri country all my life.
That's lovely. Now, you've worked in a number of places, and I met you probably about 12 years ago. Maybe I'm trying to work it out while you're at the dental hospital.
Yep, I was at the dental for 10 years. Prior to that, so I started working a long time ago. I'm in my 60s now, but I started working in social work initially. And then in Aboriginal health, my first position in Aboriginal health was working with our elders at ACECS, Aboriginal Community Elder Services. I worked there for about 5 years in their Kuri CAPS program, assessing the needs of our elders and supporting them to live independently in the community, brokering services for them so that they could live independently. I did that for about 5 years. Then I worked at Dental for 10 years as their first Aboriginal Liaison Officer at Dental Hospital in Melbourne. And I'm currently working as in an Aboriginal liaison role as well at the ACECS Hospital, been there for coming up 3 years now. But I met you and your beautiful family, I think, when you were accessing services, but you were also working at the dental hospital doing some of our cultural awareness sessions for our staff and our exec at the dental hospital, AJ. So it would have been about 12 years ago.
Yeah. And the interesting thing is you've gone from dental to the ear and eye hospital.
Yeah, well, that move was intentionally in a way because I've stayed in we're still a specialist service at the ACECS Hospital, so it's quite different from working in a large acute mainstream hospital. Yeah, I'm really enjoying it, very challenged at times with my work there. It's quite different. It's not just a clinical role. I do a lot of the program development and the work on the reconciliation action plan for the hospital. I do a lot of training for the upcoming nurses being trained through the hospital in cultural awareness, some of their policy development, the Aboriginal employment plan and acknowledgement to country policy. Yeah, so it's a good role. I've got quite a mix of clinical plus doing other responsibilities that are a bit more challenging.
A question to you, what does reconciliation mean to you?
It's really about partnering, working together and truly listening to each other, I think, and the needs of our Aboriginal brothers and sisters and where we're heading on our health journey. And I think that we mainstream services need to listen and learn from what the needs are of the Aboriginal community in that space in order to work towards closing the gap.
Yeah. Do you think people really understand what the gaps actually are?
I'm not sure, because I do know that certainly with the Closing the Gap campaign, we only achieved, I think it was 3 out of the milestones that we were working towards. And that's come about for many, many reasons. Probably one of the reasons being that people don't fully understand what we need, or maybe we're not given that voice to advocate what we really need and what we really want to support our communities.
Yeah. Do you think it's being taught more at schools about the gap, but not just the gap itself, but about Aboriginal issues in general?
Oh, more so from when I went to school, AJ. I mean, I went to school and there was nothing taught, you know, it was colonisation, the point of colonisation, and that was it. I was born when we were still flora and fauna to this country as a First Nations woman. And as I said, I really didn't learn much. Some schools are embracing it and teaching their students more than others. It depends on the demographics of the area, I think, and the number of Aboriginal students that they have enrolled in their schools. So I do think some schools are doing it better than others. But I am pleased to see that it is it's part of the curriculum now. It's becoming part of the curriculum more so in more and more schools. So our children are learning, and that's where we have to start teaching about Aboriginal history and the legacy of our history from the early years, the early learning years.
Yeah, no, I agree with you. I do think at the moment there's still some teachers struggling a little bit about understanding the history themselves, let alone being able to teach the kids the history, if that makes sense.
I think that learning or wanting to learn depends upon one's own the way you've been raised and the values that have been instilled in you and how open you are to learning and embracing it. Because I know that I've met a lot of people that are allies and that are really willing to learn and open their minds to things and set aside or even recognise their own biases. That might be something that's been instilled from their early years. And it's hard for some people to recognise their own biases and move on and open their minds to that learning of Aboriginal ways.
Yeah. And even as an Aboriginal woman, you're on your learning journey as well, aren't you? Like, I know people go, hey, you're a consultant, you should know everything. I don't know everything.
No, none of us know it. We only know what we've experienced and what we've grown up with. Personally, I didn't learn of my Aboriginal heritage until after Nan passed away, and that was when I was a married woman. I was expecting my third child, and it was only at that point in time that it was confirmed that I was of Aboriginal heritage. I had my suspicions, and Nan had I spent a lot of time with Nan as I was growing up, and I remember going and doing rabbiting and picking the blackberries and learning to live off the land a little bit. So she taught me some Aboriginal ways without actually telling me that I was of Aboriginal heritage. But it made sense as I got older, and I thought, well, maybe that's why Auntie so-and-so is so dark-skinned. You know, it became more apparent to me that and why I feel and sense things in a different way, I guess. So it did make sense to me once I found out, but I didn't know that that was the case, as I said, until I was early 30s. And I've embraced it ever since because it is a big part of me. I have an Italian heritage from my father's side, but my Aboriginal heritage is from mum's side of the family. So I embrace it, and I'm still on my learning journey. As you say, we all as Aboriginal people know as much as we know, as much as we've learned. And I try and share that with people that I meet because I embrace it and I love that that's part of me.
Do you find that there's a lot of Aboriginal people that don't know much about their history and culture?
Oh, for sure. I met a lot of Aboriginal people I've met a lot in my journey, particularly working in hospitals, and a lot of people don't know, and sometimes I feel as though they're a bit disadvantaged because nowadays there's a lot of requirement for proof of Aboriginality, and a lot of our people don't know their connections and their mob, and if they're second or third generation stolen and have been brought up in foster care, and they don't know. They want to know, but it's very hard to find that information sometimes for those people. So I do think that they're a bit disadvantaged.
So 5, 4, 3, 2, 1. So Carleen, how do you define Aboriginality?
For me, it's I mean, the legal definition is about our descendancy and how we identify ourselves and how we're accepted and acknowledged by the community that we live in. And I guess I sort of follow that guideline a little bit. But I know who I am, and I stand strong in who I am. And some people might not know my family connections, but I know. So that's what's important.
Yeah. Do you find that there's lateral violence in community around Aboriginality?
Well, certainly, as I say, I stand strong because I know my connection and where I'm from, but some people might not know my family and might try and deny me my right to self-identify as an Aboriginal woman. And it's a shame that there is that lateral violence, because particularly in Victoria, there's a lot of people that don't know their connection to culture and community and their history.
Yeah, I think that's what a lot of people don't realise about Melbourne. Melbourne's got one of the highest transient Aboriginal populations anywhere in Australia, which means they're not the local people. They're people from all over Australia, and they come with their own stories. And I think as well, I don't think I've seen a capital city with so many gathering places around it as well. And, you know, gathering places are established for lost souls to kind of reconnect. And we're actually in that melting pot right at the moment.
There's a new one, I believe, too, that's opening up in Glen Iris called the Murnong Gathering Place, that has its official opening with Uncle Shane Charles and Auntie Zeta Thompson are opening that actually this Thursday in Glen Iris. So that's under the city of Boroondara, that they recognised they needed to have another gathering place, because Mullam, as you know, is out in Ringwood Way. Yeah. So they wanted something a bit closer for people. I think they've got, I'm not sure, 1,500 or something like that, Aboriginal people that identify in the city of Boroondara.
Yeah, I think when I first heard those figures, I was a little bit shocked, but I shouldn't be shocked because we don't, like Aboriginal people, again, my own stereotype would be, what am I looking for? Who am I looking for? If that makes sense. Yeah.
Well, that's right. We can't tell by looking at each other more often than not. It's by having that yarn and talking about our connections. And it's really interesting. I've met so many people, as I say, in working in health, so many Aboriginal people, and I find that I'm connected to so many of them. Being a Victorian Aboriginal woman, I'm connected to so many of people that I meet on my journey. So it's wonderful.
So do you have any role models yourself or Aboriginal people that you look up to?
Probably my mum.
Yeah. My
mum tends to be my mentor and the person I go to when I need to bounce off ideas. And there's some elders in our community too that I might go to when needed.
Yeah.
But I'd say my number one role model is my mother.
Yeah. What makes a good Aboriginal leader?
I think someone that's prepared to listen and be non-judgmental, and give good advice. Give advice from the heart and the head.
Yeah. Yeah. So you've got kids yourself now. What aspects of Aboriginality are you ensuring that they install in their lives?
I all my children know where they're from. They know their history. They embrace that knowledge that they are of Aboriginal heritage. It was only my youngest child, who's now 19, that was fortunate enough to go to Yapra preschool, where he learned his culture from a very young age. The other 3 children learned a little bit at school, but not a great deal. And my 3rd child actually works in an identified role as a maternal child health nurse. So she works with our mums and bubs in the city of Hume. So all of my children do acknowledge and embrace their Aboriginal heritage. My eldest boy works for Taungurung Land and Waters Corporation 2 days a week. He's working for Envirobic. So 2 of my 4 children are actually working in identified roles, and the other 2 embrace their Aboriginal heritage but are not working in that space at this point in time.
Yeah.
So what they know is what I've taught them, what I've passed on, and what Nan has also passed on to them as well.
Yeah. Now, I know one. I've met your daughter before, the nurse. I've met her, but I also have known Chris for a number of years as well. A real fun young gentleman. He finished school last year. No, the year before last.
Before, yeah.
Yeah. So what's he doing at the moment?
So he's working. He was doing a Bachelor of Arts at uni, at La Trobe Uni, but he's taking a bit of a break from that at the moment while he's working out his career path. But he works several days a week at the Ioneer Hospital in an admin role there.
So he's back into health like the rest of the family, just in a different place.
He is, actually. Yeah, he is. The second boy doesn't work in health. So of the 4 children, I've only got the 2 of them that are working in the health space, and the other 2, one works, as I said, he works for Envirobic and he runs his own gardening business as well. And the second child, he studied law and he works at ACECS.
That's a big difference, but at least they're all healthy, happy, and they all know about culture.
They do, and I think it's so important for the young ones to know about culture, to learn their identity. It helps them to stand strong in life, to have that knowledge of their identity. Very, very important.
With clients or with people, with Aboriginal people that don't know about their identity or want to know more, where would you suggest they go to as a starting point?
Usually I'll suggest that they can make contact with LinkUp, who might be able to at least point them in the right direction of where to start looking and what information they need to gather to find their family connection. Sometimes I think we need to be very mindful that finding that connection might unearth a lot of, it could unearth a lot of negative issues for that person. So I do think a person needs to be ready in their own emotional and spiritual well-being to start that journey, because it can be very difficult.
Do you think people are prepared when they do start searching of how difficult it can be and how hard the process might be?
Probably not, AJ. I don't know if you can ever fully prepare someone for that. There's a lady I've been speaking to, one of our clients at the Ioneer. I've been speaking to her recently, and she's going through a lot of issues with her health at the moment. And she spoke to me about finding her, and I treat her as I would any other Aboriginal patient, but she believes she's Aboriginal, but she doesn't have her information yet. And I have spoken to her about LinkUp, but advised that at the moment she needs to get some of her health issues sorted before she has the strength, I think, to go down that pathway, because, as I said, it can be a very difficult journey for people, and sometimes their family, their community might not accept them, or their loved one has passed. So it can be difficult.
Now, oops, so there's some echo there. As you mentioned before, we are in the middle of NAIDOC week. What does NAIDOC mean to you?
For me, it's celebrating our history and our culture and our resilience and our survival as a culture for such a long time.
And this year's theme is for our elders as well?
Yes, it is. It is acknowledging, I guess, that they paved the way, the work that the elders before us have done to pave the way for all us younger generations. And we need to keep on with that and doing the good work that they've done.
How can we as a population keep the elders' stories alive?
I think with yarning and passing those stories on to our younger generations. I pass the stories on all the time, or I try to the best of my ability with my children and with my up and coming grandchildren. I'm expecting my first grandchild in September, and I bought a special gift for that baby, and it's a piece of artwork that tells the Dreamtime story, the creation story of the platypus, and I will share that story with that baby. And I did that with my children, all my 4 children as I was growing up. I used to read them Dreamtime stories at bedtime.
Well, congratulations on the becoming a granny as well.
Yeah, thank you. Very exciting time in our family.
You're looking very excited.
I am very excited about it.
Yeah. So how would you ensure that this grandchild is culturally safe in the world out there and culturally prepared?
I think by just telling the story, sharing the stories with this child. I do, and I have always taken all my children to Taungurung Land and Water when we have events, and we have camps at Jungai in Rubicon. I've always, wherever possible, take my children to allow them to learn and choose to embrace that part of their identity. And I'll do the same with my grandchildren.
I'm going to ask you a couple of questions. I know you grew up in Melbourne, but where did you go to school, and how much Aboriginal studies were you taught at school?
I went to East Kew Primary, and then I went to Kew High, and I really didn't know anything at all. I wasn't taught anything about Aboriginal history that I can recollect. Nothing.
So when you started studying after school, was there anything in the courses that you studied about Aboriginal issues? At
school, it was all Captain Cook.
Yeah. But
in tertiary studies, you mean?
Yeah, tertiary studies.
In tertiary studies, when I went through uni,
yeah.
No, AJ, there wasn't. And I do know that I think the universities are all introducing that on their curriculum now. Part of my role with the INEA is we go out to Melbourne Uni and talk with the upcoming optometrists and speech therapists and the audiologists that are studying through that university, and we try and teach them a little bit about our Aboriginal, the care that we provide for our Aboriginal patients in that health sector, and try and support some understanding around the barriers and why It's challenging at times for Aboriginal people to access services in a timely manner.
What is that people often ask, why is it that Aboriginal people often turn up to hospitals when something's infected, sore, pussy, enlarged, and I want help right now, which is why Aboriginal health is quite reactive. What other barriers do you think that Aboriginal people face that prevent them from seeking help a lot earlier?
I think sometimes it's the expectation of community and family and the roles that we play in family. Often Aboriginal women are caregivers in large families and extended families, and it's very difficult to look after oneself when you're looking after so many other people. That's one thing, but then there's financial barriers, transport issues, health literacy, lack of understanding that doing ABC might prevent that situation becoming really difficult to manage. And we still do see people that are accessing services a lot later than they should be. We see those statistics all the time in health, and we shouldn't in this country.
I think I always find that Aboriginal health is very reactive in terms of, because people are turning up in later stages, we're responding to issues in later stages. How can we start to get professionals to become more proactive when working with Aboriginal families? I know that's a big...
I think it's a big question, but I think a lot of the work we do with our maternal child health nurses that are seeing our babups from a very early age and instilling messages and doing checks at that point in time, the lift the lip, have a look at the teeth, have a look in the ears, pick up some of these issues from early on. And a lot of promotion around, say for older people, a lot more promotion in doing cancer screenings and things like that. There's a lot going on that didn't exist even 20 years ago when I started working in the health space.
Yeah. In
Aboriginal health, that is. So there's a lot more that I see that is going on, a lot more positive things to support people to understand. Our Aboriginal health workers, they do a great job in supporting people and trying to pick up things early on and support people to understand smoking cessation, things like that didn't exist 20 years ago, AJ, and there's a lot going on, I think, to help Aboriginal people to address issues from an earlier point of time when things are a bit more manageable.
And you mentioned working with health professionals and students and education. What are some of the questions that often come up from the students? Ones that you hear kind of all the time.
It amazes me whenever I do any training with our students or even adults that I work with at the hospital, there's this sense of guilt of, I didn't know that this is the legacy of the history of this country. I didn't know. And I think people have a duty of care to find out. They live in this country. They need to go on their own learning journey and learn more about our First Nations people.
Do you think that the students are much more willing to know and willing to ask questions when you're there?
I think so. I tend to support understanding by using patient stories. I think that that's a very powerful education tool to share stories, because then the learning is very real for them, and tease out some of the barriers and what can be put in place, and how to, even going back to the simples of asking that Indigenous status question and letting people know that there are Aboriginal health workers at the hospital and they might be able to support their journey through the hospital. So going back to that sort of basic thing, I think will help our patients coming through. But our young ones are a bit more interested in learning. And as I say, I'm pleased to see that it is being introduced in schools and universities as part of curriculum. It's a bit late, but better late than never.
Look, I didn't realise until just recently, I graduated my social work degree in 1997, and I did my nursing, finished my nursing in 1991. And
yep.
I think either not in my nursing course and not in my social work course were Aboriginal studies taught in. I had to go to a different university to pick up an elective about Aboriginal studies because my own social work course didn't cover it at the time.
Yeah.
I agree.
Well, I did.
It's good to start hearing it's being incorporated.
It is finally, but as I say, it is being incorporated now. I did my social work studies in the early 80s, so a lot earlier than you. But and certainly at that time there was nothing in the education curriculum around Aboriginal studies, and but it is nice to see that it is coming in now. It's finally happening that the universities are recognising, hey, this is really important. We need to learn this. We need to embrace it.
How do you think we can get more Aboriginal people into tertiary study to start off with, but into some of those jobs like nurses, midwives, social work, aged care?
Supported placements sometimes. I think also looking at our own students here, often it's difficult. A lot of Aboriginal students that are supported in our schools and our universities are coming away, are leaving family. You know, their family might be from Central Australia and they're having to leave family and their community to come here and study, and that in itself poses a lot of challenges and barriers for them to completing their studies. So I think these students need to be really well supported, and given opportunity. We had dental trainees, Aboriginal trainees that came through the dental hospital. We introduced that whilst I was working there. And there were a few of them that wanted to go on and do further studies, but unfortunately they had to go all the way to La Trobe out at Bendigo. They weren't able to go to Melbourne University across the road because they didn't have VCE. So that made it really difficult for them. They had to move to Bendigo. And one of them persisted, and he qualified as a dentist several years ago, and he's gone back to his community in Queensland and working there as a dentist, and I'm so proud of him for seeing it through. But it was very difficult for him.
And I love those true real stories about where people have been able to achieve and been able to take things back to their community. Because often we see that when they come to Melbourne or go to Sydney kind of thing, they often are trained, but then they're not able to take those skills back home, if that makes sense.
It was such a success. I mean, at the time, the dental hospital were disappointed that he didn't stay here, but I just saw it as such a success story that he was able to take all that back to his own community, and he just, I'm so proud of him and his achievements. But I do know that we have a student that did her traineeship at the hospital, and she's still studying. She wants to further advance as an oral health therapist.
Oh, wow.
So she's still studying, but has to do those studies through La Trobe at Bendigo, which disappoints me that Melbourne University weren't able to embrace our Aboriginal students and take them on board there. it would have been a lot easier for them, because then they work at the dental hospital while studying at the same time and supporting themselves, living away from family, living in Melbourne.
Yeah. And if people don't know Melbourne, where the dental hospital is, it's basically across the road from the university.
Mm.
So
Right.
it would have been a perfect partnership.
It would have, because, as I say, those students mostly were coming from interstate and supporting themselves in Melbourne, and, you know, to commute back and forth to Bendigo for a few shifts at the hospital has been very challenging for them.
What do you, besides, we've talked a little bit about other health. The other health that we don't always mention is mental health for Aboriginal people. And we do know that mental health in community is really high, but how do you, or how can I get listeners to non-Indigenous listeners understand why is mental health for Aboriginal people at double the rate of non-Indigenous people?
Oh, that's a big one too. There's a lot of
I didn't say it was going to be easy talking to me.
no. There's a lot of I see that a lot of young ones are burdened sometimes by what's going on in community. We touched on just previously about some of the lateral violence. If those people are not known in community and embraced, that there can be that lateral violence that impacts on someone's spiritual well-being. Not knowing your heritage, that again, that's another thing. And I think alcohol and drug misuse, that certainly does affect spiritual well-being, but that is often the band-aid when there are the underlying issues are mental health issues, and the alcohol and the substance misuse is the band-aid that people reach for. There's a lot of disconnect within some families that affects our young ones. I think we all have a duty to look after our young ones better, because they're our future. They really are.
And I don't think people understand that, you know, that 54% of our population is under the age of 25. So
yes, we in Victoria, certainly we have a very large growing population. So we need to do better. And I work in the ENT space, and we have a lot of our children are living in out-of-home care still. AJ, that's a big issue. They're not living with their birth parents, which is a real concern.
Yeah, and I think these are the stats and facts that we need to make sure that the new graduation of health professionals and the ones that are actually in the professions at the moment have a really good understanding of. Don't you agree?
Certainly, yeah, certainly. Because if you can't open yourself to understanding some of these issues, I don't see how we are going to close this gap, which I believe is still standing at about 10 years or something, the life expectancy gap, which is appalling in this country in 2023.
I think the hardest thing that for people to get their heads around is how recent in history a lot of these things really are as well. That people think some of this stuff happened hundreds of years ago, but we're talking about things that happened in your lifetime. When you mentioned earlier on that you were 6 or 7 when the referendum of 1967 occurred, for example. That's a really big thing for Aboriginal people. But before that 1967, as you said, that you weren't counted in the census and you weren't considered. You were considered like fauna and flora in this country. People, I don't think, would actually look at you and think, oh my God, it's that recent. Would they? Like,
It is. It's very recent, and it's appalling that you know, I was 5, I think, before for the '67 referendum. Then we became counted as citizens in our own country. I struggle to get my head around that because it's just crazy.
Yeah. And I think it's something that kids these days are kind of learning, but I still think the thing that's missing in schools is how the teachers teach impact. Like a teacher can teach a kid in year 10 who would have been born in 2008, 2009. This stuff happened in the 1967 referendum. But if they don't explain, that's the elders in our community right now. That's you standing up in the front of the room. This happened to you in your lifetime. I still sometimes think that the kids don't really get to connect how it relates to people today.
How recent it all is. That's right. How recent it is, and how many of our elders have grown up on the missions. You know, those years were not all that long ago, really. A lot of our elders are still alive that grew up on missions.
Yeah. And I know the one big thing that gets talked a bit about all the time is, you know, that as workers, we have to work with a trauma-informed approach, trauma-informed practice. My biggest concern is I don't really think a lot of people understand where the trauma actually comes from, because I think they automatically go colonization, but there's a hell of a lot that's happened since colonization as well. Like you mentioned before about kids being in care and about high rates of mental health and suicide rates that are quite high and juvenile justice issues, that I think that so many people are fixated on the past and colonization. I'm not saying colonization didn't start things, but to do really trauma-informed practice, you do need to understand the recent trauma, is what I'm saying as well. Stuff that's actually happened in your lifetime, stuff that's actually happened in my lifetime.
Yeah, there's a lot that's still happening. Sadly, a lot of issues that are still occurring, and we do have really overrepresented. Our youth are very overrepresented in the justice system, and I have concerns that these youth are not given the opportunity to reform and given opportunities when they go back out there into community. I know that, say, at the hospital, we recently had the Torch do a mural for us at the hospital. We created a welcome space, an outdoor welcome space for our patients to sit and feel more culturally safe. And we've installed a mural there that artists from the Torch have done that, and they work with our prisoners in our prison systems and that are on community release, and give them an opportunity to work and to create art and to make a living for themselves, so that they can stand on their own 2 feet and not find themselves caught up in that merry-go-round and back in the justice system. So there's a lot of really good people that are trying to do good things. That's just one example of an organisation that I think are doing wonderful stuff.
And we are seeing a lot more young people standing up, both politically and standing up to actually create platforms for Aboriginal stories to be told. Because I think there's been a long time where our voices haven't been able to be told, if that makes sense. And I think we've got to a place where those voices are starting to be heard. And I always remind people that it was only a few NAIDOC themes ago that listen to our stories was the theme.
Yeah, that's right. And we learn from those stories because they're real and you can relate to something that's real. And I do love about NAIDOC that we do nominate some of our youth, our youth that are represented in sports and other areas, and they're acknowledged and they're given awards during NAIDOC. And it's fantastic to see that, because they are our future. And as you said before, Victoria has a very large and growing Aboriginal population.
Well, I'm just watching the time, so I've got a couple of final questions for you. And the first question I've got is, what would you like people to walk away with from our conversations today?
I think I would like people to take time to truly listen and have conversations and be open to learning about some of the richness and the beauty that that Aboriginal culture has to offer this country.
Yeah, that's really sweet. And I do hope that we can end up closing this gap. I don't know whether the gap's going to get closed in my lifetime, but it's going to be, at least my kids might see some of those gaps get closed, and my grandkids start to see those gaps get closed.
I certainly hope so. And I've seen a lot in my lifetime, and I do always reflect with my children and with any young ones that I meet on some of the positive stuff. Somebody asked me at work, how do you keep your head up high when there's just so much negativity? And I say, well, there's so much beauty and there's so much wonderful things going on. And I know when we put on any events at the hospital or as I said, when I meet people and speak with people, I do try to focus on the wonderful stuff that's going on in community and the good things that are happening, because there's a lot of good going on and a lot of change that I've seen in my lifetime from, you know, as I said, when I was born, I wasn't flora or fauna of this country, but there's been a lot of change, a lot of positive change.
I'm not going to get too political here, but I'm going to say, have you seen the racism and what's actually happening with the voice discussions that are actually taking place at the moment?
I have, and it saddens me that that there's this element of fear. I think people are a bit fearful about it all due to possible lack of information. And I don't know where, if we have a no, if we have an overwhelming no vote, where that will leave us in our journey towards reconciliation. I really don't know where we will stand. And I certainly have seen, have felt impacted by the negativity and the increased racism. It certainly has impacted upon me personally too.
Well, I want to leave on a happy note. So what's one thing that you've done in your life that you're so proud of?
My children are my biggest achievement in my life, my 4 beautiful children.
Yeah. And I'm partial to one of them. I love Chris. As I said, I've known Chris for a number of years, and he was in my mentoring group at the school. So I really do admire him. And look, I think, and as a mum, I think you've done a really great job raising him, like you've done with raising your other kids as well.
Yeah, they're my biggest achievement in my life. But also, I think I've chosen a difficult, but also a career pathway that I've got a lot out of it myself personally. Being able to help people in their health journeys is incredibly powerful and important to me.
It is. And I think sometimes we as health professionals, we need to remind ourselves that, you know, when we are working with an Aboriginal family, we are working with the individual, but we're working with their family too. If we can if we can fix something or pick up something early, we may be creating the firsts in that family. Like the first,
That's right.
you know, that maybe helping them to live a lot longer, or if you're supporting a young graduate who might go to the hospital to work, that might be the first family member who's ever reached year 12, or the first university a person in the family able to get to a university. We are now the change agents to help this first occur, if that makes sense.
It certainly filters through, you know, with one person that you might be able to support in a positive manner, that story will go back to community, that voice will go back, and people will feel safer to access our services. I honestly believe that one person having a positive experience will go back, and it'll be a very strong influence for community.
Well, I'm just watching the time and I know I have to go. So I want to say thank you very much, Carleen.